Hi, this is Dr. Derek Robben. I'm one of the founders of Tampa Bay Psychiatry here in Tampa. I'm a board-certified general psychiatrist and addiction psychiatrist, and I wanted to take just a couple minutes to talk about a topic, an issue really, that has become very important, especially in these times of coronavirus, and that is alcohol use versus alcohol abuse and what type of treatment we could potentially offer you. Depending on the statistics you read right now with the coronavirus, there's been anywhere between a 30 and 50% increase in what's considered moderate to heavy drinking. So let me first start by telling you what is considered moderate drinking. Anything more than 2 drinks for a male at any given time, so 2 drinks a day or 14 a week. Anything more than that is considered moderate drinking. For women, it's half of that, so 1 drink a day or 7 per week is anything over that is considered moderate drinking. Binge drinking is defined as more than 5 in one episode for men and more than 4 in one episode for women. And so what we're seeing with the coronavirus is that due to a number of factors, isolation, more free time for a lot of people, we're seeing those numbers of moderate and binge drinking, the statistics are going up considerably. People always ask me a lot, how do I know if I have a drinking problem? Or how do I know, even more frequently question is, how do I know if a loved one of mine has a drinking problem? Well, we use specific criteria when we're looking at determining if somebody has an alcohol use problem, and if they do, the severity. And we use criteria that were developed by the American Psychiatric Association based on 50 plus years of research and data. And basically, there's 11 criteria that we use. If somebody meets 2 to 3 of the 11 criteria, it's considered a mild alcohol use disorder. 4 to 5 of the 11 criteria is considered moderate, and 6 or more is considered severe. When you look at those 11 criteria, you can really break it down into a few really key things. One is impaired control. That's really the hallmark of when a drinking issue or a drinking problem becomes more consistent with an addiction. When somebody loses control over their ability to control their drinking. Risky behaviors, impaired social functioning, that could be at home, in relationships, it could be at work. And then the last one is physical dependence. And we look at physical dependence based on tolerance and withdrawal. Really, where I come into place, especially with the first part of getting treatment, is detox. There's 2 parts to treatment, really. The first part is safely medically detoxing from alcohol, and the second part is the actual treatment. And why is the detox part so critical is because there are conditions like seizures and delirium tremens, or DTs, which could potentially be fatal. Roughly 20 to 25% of people that develop seizures or alcohol withdrawal, delirium tremens, actually don't survive. So it is considered a medical emergency. And the good news is, for the overwhelming majority of patients that I see, we can do ambulatory detox, or we can do detox safely in the outpatient setting rather than going inpatient. We can work on an outpatient basis with the individual, and usually that entails you come in, you're evaluated, we check your vital signs, we make sure that you're appropriate, we don't need to send you to the emergency room, and then we see you every day for roughly 5 days or so, give or take. And during that time, I'm prescribing medications like benzodiazepines, primarily Librium and Ativan. And what we do is we taper the dose down over 4 or 5 days. And this really, for most people, is a very, very safe alternative to being admitted into a hospital for detox. So that was really the point of the conversation I wanted to talk to you today about. Again, just want you to know that there is help out there. I think many people are under the misperception that you have to go into a hospital or detox center to get safely medically detoxed from alcohol, and that's just not the case. The overwhelming majority of patients actually can do it on an outpatient basis. So I hope this video was helpful for you, and again, this is Dr. Derek Robben, Tampa Bay Psychiatry, and I hope you have a great day. Thank you.